Okay, so the last section I want to go through in the equine lameness evaluation is a summary of a few other blocks that we've mentioned already. And then we'll look at the diagnostic techniques that we've mentioned in relation to actually figuring out what the problem with the tissue is. Again, you've covered this in diagnostic imaging, so it's really just pulling that together before we finish off this section and move on to think about the next part, which is dealing with orthopedic problems. So we talked so far about perineural analgesia and intrasynovial analgesia. Just to mention, there are some other blocks as well. For example, we've mentioned when we talked about nursing care of the eye, the fact that we can provide perineural analgesia and anesthesia of the eye to facilitate ocular examination and treatments and so on. So if we take, say, this horse here with a very large, deep corneal ulcer, and you can see as well there's pus and corneal edema in the anterior chamber, that this animal is going to resent handling of the eye unless we can make it pain-free through the use of blocks. So if we think back to our lectures on care of the eye, we talked about our supraorbital and palpebral nerve blocks, which will allow us to, desensitize the eye and examine it without causing the animal any undue distress. The site for the supraorbital nerve block is the little foramen over the orbit, and the palpebral nerve can be palpated on the zygomatic arch, sort of midway between the eye and the ear as it runs over this bony structure. So again, if you get a chance on the live horse, palpate those structures and they're easy to find. We also talked about using local anesthesia to place lavage catheter. So the horse here on the right is pictured with a lavage catheter in place, which was fitted using local anesthesia of the structures around the eye to allow us to safely medicate this patient's eye without having any problems with him, and also avoiding the need for a general anesthetic. And we mentioned as well in relation to bladder disease, the fact that we can use a pudendal nerve block to allow the animal to extrude the penis if it's a male, and to facilitate lavage of the bladder and catheterization of the urethra. So again, if you remember back to that lecture, we talked about using a 1.5-inch 21 gauge needle. You insert it onto the clean skin underneath the anus. You angle it down at a 45-degree angle towards the dorsal edge of the pubis, and you inject 20 mils of local anesthetic there on both sides and wait for about 20 to 30 minutes. And at that point, then the horse should have a relaxed penis that you can catheterize or clean or lavage the bladder or do whatever you want to do. So hopefully that's revision of something that we did not too long ago at this stage. So in summary, we're saying if we're placing local anesthetic underneath the skin around a nerve, we want to be cleaning the site with isopropyl alcohol and allowing it to evaporate before we place our needle in there. Whereas if we're going into a joint or into a bursa or a tendon sheath, we're going to be clipping the hair, we'll be performing a full surgical scrub, we'll be using sterile equipment and a new vial of medication to minimize the amount of bacteria we're going to risk introducing into that joint or that synovial structure during the procedure. Whichever one you're doing, your anatomical knowledge is going to be important. So revise anatomy of the equine distal limb in particular. And remember, if you're not sure where to inject or to prepare a site, just ask your colleague to show you before you start so that you're all on the same page. That will just avoid any kind of unwelcome surprises or clip marks in the wrong places, which, it's easy to take the hair off, but it's not so easy to put it back on. So that's useful. Often we're doing these procedures on animals who are conscious and often not sedated. So it is important to pay attention if you're holding the animal while someone else is putting needles in their legs. Watch out for that and don't just look out the window or look at your phone and not restrain them properly. Likewise, if you're the person placing the needles, make sure your colleague is paying attention and that you warn them when you're about to do it so that they can be on alert. In relation to exam questions, this comes up quite a bit, and we find that a common weakness in student answers is that they're not able to describe how to aseptically scrub the skin in detail. So either leave out bits or they describe an incorrect technique. For example, people are describing using cotton wool to scrub skin. Now, you may have seen that in practice, but you should know from your lectures that using cotton wool risks leaving bits of lint behind on the surface of the skin, and we don't want to do that. So a gauze swab is a much better option. So do go back and revise this from your surgical nursing lectures in particular it is important that as a vet nurse on the first day of being qualified, this is a task you're able to do, you know, to a high standard. And a lot of patient well-being depends on it. Okay, we'll assume now that we've taken a history on our horse, we've examined it, we've performed a clinical evaluation at the walk and trot, we've flexed it, circled it, we've located a limb or limbs that seems to be causing the problem, we've done some regional analgesia, and maybe we've blocked some joints, and we've narrowed down the source of lameness to hopefully a single area on the limb. The next section then is to try and pinpoint what individual structure is causing the pain. And we'll normally switch to diagnostic imaging at this point. So radiography allows us to examine bone in particular. Ultrasound is particularly good for soft tissues. So often we'll use both of those imaging methodologies to get a full picture of what's going on. So for example, if it turns out that the horse has fetlock pain and it blocks out to a intra-articular injection of local anesthetic into a fetlock joint, then we'll do a radiograph series of that joint to look for bone or changes, whereas the ultrasound examination will allow us to examine the joint capsule, the ligaments around that joint, the soft tissues associated with it, and so on. And then we also have the option of more advanced imaging techniques. So magnetic resonance imaging, computed tomography, and nuclear scintigraphy are all techniques that are available for use in horses and other species in Ireland and abroad, and they are being increasingly widely employed. MRI, for example, gives us more detail about soft tissue than ultrasound in some cases, and nuclear scintigraphy is very good at detecting bony remodeling or stress fractures before they become a much bigger problem. So if we can pick up a little stress fracture, say in a tibia, we can then rest the horse and allow it to heal. Whereas if we keep working that horse, we're increasing the risk of a catastrophic fracture, which is obviously what we want to avoid. So you'll find a wide variety of imaging techniques used in practice. If you talk to nurses in specialist equine hospitals, a lot of them specialize in imaging. It's an area that nurses can take control of and be responsible for getting really good quality images to complement the work of the equine diagnostic team. So it's something to keep in mind. If we think about radiography now, this is revision. You've done this in your diagnostic imaging module. So again, it's no harm to go back and revise this if you need to, but hopefully you'll remember it from before Christmas. So a lot of equine lameness evaluations end up with some radiographs being taken. This is something the nurse can do at the direction of a vet. So the vet should be able to say to you, please go in there and take a series of images of that horse's left carapace. And then they should come back maybe 20 minutes later to find a beautiful set of perfectly diagnostic, beautifully exposed and collimated images hanging up on the viewer or visible on the computer screen for them to admire and make a diagnosis from. So that's what you're aiming for. Bear in mind as well that the equine radiography is one of the tasks in the diagnostic imaging station on your final OSCE. And if you look at that task, the instructions for it are on the veterinary nursing OSCE Moodle page. You can see you're asked to take any one of the 4 common views of a carapace, a tarsus, or a fetlock joint. So that's a dorsopalmar or dorsoplantar view, a lateromedial view, and then either of the 2 obliques, a dorsolateral palmar medial oblique or a dorsomedial palmar lateral oblique. So again, if that sounds grand, no problem, but if that's a little bit vague, go back and revise it. Please don't fail your OSCE because you took the wrong view of the wrong joint or the wrong limb. That's quite frustrating for all concerned. So do go back and revise your anatomy if that seems a little bit confusing. Okay, if you have a look in your notes for this section, I've gone into a bit of detail in how to prepare a horse for ultrasonic examination of the flexor tendons. So I've picked the flexor tendons of the forelimb as probably the most commonly ultrasounded site in the horse, and I've described in detail how to prepare an animal for that procedure. So have a look through those. Again, that's something the vet can ask you to do while they go off and talk to the owner or look at the radiographs. So they should come back and be ready to take good quality images from the beautifully prepared limb that you've left for them. Okay. So have a look through the notes. I've gone into detail on how to do the task. Remember, the aim is to remove as much air and hair between the head of the ultrasound machine and the horse's skin. So air and hair inhibit good image quality. The better a job we do at removing hair, at degreasing the skin, at allowing the gel adequate time to soak in, the crisper and sharper the image we'll obtain. So that's really important. Okay. However, the procedure is similar for whatever part of the body or the tissue the vet decides to scan. So whether it's flexor tendons in an athletic horse or the abdomen of a foal with colic, the principle is the same. However, bear in mind, the good news is when we're scanning the heart or the thorax, so looking at the lungs of a foal, for example, or the abdomen, we're normally using a 5 or 3.5 megahertz scanner. We generally don't need to clip the hair coat to get a good quality image. So if we think about clipping the hair coat off the flexor tendons of the horse, that's a relatively small part of the horse to clip. It's easy to do. If you imagine an adult horse with colic and they're trying to roll on the floor and they're thrashing around and they're painful, and the vet wants to do a fast ultrasound examination of various sites on the abdomen to look, say, for example, a nephrosplenic entrapment, or to check if the horse is ileus, it's not feasible to clip all the hair off both flanks and the ventral abdomen all the way from the xiphoid process to the prepuce or the udder. So it's just impractical. But the good news is if you just soak the hair coat with copious amounts of isopropyl alcohol or surgical spirit and put some gel onto it, you'll obtain a good quality image. We don't need quite as much crisp detail as we do when we're measuring, say, tiny lesions in a flexor tendon. So the good news is if we're ultrasounding the limbs, clip them before you put on your alcohol and your coupling gel. But if we're ultrasounding the animal's body, so usually the heart, the chest, or the abdomen, there's no need to clip the hair coat. You can get a really good image that will be suitable for diagnostic purposes just by soaking the hair coat thoroughly. It also means that the alcohol will evaporate, you can wash off the coupling gel, and you're not left with a very bald, cold horse afterwards. So it helps with patient care as well. Now, we were meant to have a workshop from IMV Imaging. They're a company that were formerly called BCF Technology, and they provide digital X-ray and ultrasound equipment to a lot of veterinary practices in Ireland. They had agreed to come in and give a workshop to you later this semester, but unfortunately they can't come this year. So they sent me some notes, and I've put those up on Moodle for you. You can have a look at those. They have a presentation there on how to get good quality X-rays and ultrasound if you're a veterinary nurse, and also how to care for digital X-ray equipment and ultrasound machines to ensure that they last for a long time and you get the best possible quality images out of them. You will find in practice some people just never change the settings on the machine and you're ending up with very poor quality images. Whereas if you understand what the various controls do, you can really dramatically improve the quality of the images that you will obtain. And obviously the better the image, the better the chance you'll have of achieving a correct diagnosis for your patient. So really useful. We've talked about this. In terms of advanced imaging, people often ask me, do I have to be able to take an X-ray on my own? Yes, you do. It's a task that you can delegate from a veterinary practitioner to a nurse. But if it comes to something like MRI or CT, that's not a day one skill. It's not something you have to be able to do on your own on the first day in your new job. And it's also recognised that these are potential areas of specialisation. So the Royal Veterinary College, for example, have an online clinical certificate in diagnostic imaging for veterinary nurses. So if that's something you're interested in, you can keep that in mind for after you qualify. So to recap, the role of the vet nurse, if we're helping with an equine lameness, that's something that we could ask you. This is a sample exam question. If we said to you, evaluate the role of the RVN in the diagnosis of equine lameness. So if we think about that question, when we ask you to evaluate something, the clue is in the word and value is inside it. So I'm asking you, does the vet nurse have a role or a value in equine lameness? Yes or no? And then give supporting reasons to support your answer. So if you think, yep, this is something that nurses should be involved in, go ahead and then give your reasons why. Okay, so what skills do RVNs have that would make them good at this job? So for example, you might say that RVNs understand the anatomy of the limb so they can clip and prepare the side correctly at the direction of the vet. You could talk about the fact that you're able to prepare the patient and the equipment to obtain good quality images. You can speed up the efficiency of the process because, for example, diagnostic imaging is something you can do at the direction of the vet. So you can take x-rays and then the vet just has to look at them to make a diagnosis as opposed to having spending their time in the imaging room obtaining high quality images. So if you look at that question, it's asking you to do more than just describe how to take an X-ray. I'm asking you, what is the value of a vet nurse being involved in X-rays or ultrasound or a lameness evaluation? So it's important, to think about not only what you can do, but why you can do it. And it will help you go out into practice as an RVN and, step up to the mark and take on the things that the profession can do and drive it forward. So that's really something to keep in mind. When you look back at the past exam papers, you'll see there are some questions like that that tend to come up. Just make sure you're clear in your own head what it is the question is asking you to do. Okay, again, we're back to any questions. So if there's something here you aren't sure of or is unclear to you in the notes, please pop a question onto the thread in the Moodle forum for me, and I can reply to it there so everybody can see the answer. Okay.